the cloud. Okay, we're recording. I don't know if anybody has joined us, but they may. So I want to make sure we share. Hold on. I haven't hung out with Zoom in a while. So share, there we go. And we're going to share. Give me that option. There we go. Okay, we're going to share that. Okay. All right. So hopefully you guys are seeing that. We're going to move the bar. There we go. Get it out of the way. All right. That should work. So yeah, you do you. The mouse too. So yeah.
One way we can
Like
change it to the whole view.
Oh, fancy then. Sure. All right. Go to now it'll
There it
okay.
goes.
All right, perfect. I'm going to move over here. I was going to pull out the microphone, but I feel like we should be good. I think everyone will be able to hear. So I just want to do a couple housekeeping items. I'm Heather McLaughlin. I'm the executive director here. For those of you that have not met me, it's very nice to meet all of you and see some of you again. So the doc is scheduled to speak for about 45 minutes, and then we're going to allow about 15 minutes at the end for questions. On your clipboard, you should have a little card. If you want to write your questions down, we'll collect them and then we'll go over those at the end. If by chance we don't get to all your questions, which I hope we do, we're going to email out all the answers. So that way everybody knows, what he has to say about all these wonderful things. So real quick, we're recording. I mentioned that. And then our speaker tonight is my dear friend, Dr. Joseph Leone III. He is going to tell you his bio, so I'm not going to go into that. But how we met was through hospice 5 years ago when I worked with interim hospice. He was the medical director, and I was really sketchy about the medical marijuana at the time. I'm going to be really honest with you. And I helped our patients and gave them such great quality of life. He sold me. It was amazing. I was so glad that I had the opportunity to work with him. He was also there as the physician for my father when he was in hospice. So I have a lot of respect for this man, and I'm always very grateful to him for everything that he's done. And Dr. Leone, please take it away.
So as Heather said, I'm Dr. Joe Leone. I'm a local guy. I tend to get a lot of abuse that I never left the zip code because I was born at St. Vincent Hospital. I went to Sacred Heart Grade School. Then I went to Gannon. Then I went to LECOM. Then I did residency at St. Vincent. I'll probably die at St. Vincent, right? So my whole circle of life in the hospital, right? In that hospital. So I'm a local guy. I was an independent family practitioner, still am considered that, for the last 25 years. So I own the Erie Medical Marijuana Clinic. I'm also the medical director at Pyramid Healthcare, which is an outpatient drug and alcohol rehab center, which it's funny because a lot of people think there's a conflict when it comes to that medical marijuana. But someone who's been doing drug and alcohol for 20 years, I think actually is pretty well established in that field to understand this and how this is not a recreational drug. And we'll get into all that. I am also on the PA Athletic Commission medical board. I do all of the professional and amateur boxing, MMA, things like that. Been doing that for many years. And once again, I'm a board certified family medicine physician. So I was actually the first physician to get this license in Erie, Crawford, Venango, and Warren County to actually certify patients for medical marijuana. I have certified the first patient in all those counties, and I've certified the most. I have issued over 17,000 medical marijuana certifications. So I have a lot of experience in doing this. Okay, so I don't practice alone. I actually have two partners. Maybe I can get the mouse to work. Maybe I'll put it on paper. Oh, spacebar?
Try, okay. There we go.
There we go. Just
okay.
hit that.
Just do that.
So these are my two partners. So you'll see we keep it real light with all this recreational stuff. You can't just ignore the elephant in the room, but at the same time, we like to keep it light and sort of use that as sort of just a bridge to calm people down. So those really are my partners. But all right, so today's topic. So what is marijuana? How does it work in the body, the endocannabinoid system? What is medical marijuana? What is its benefit to a cancer patient? And how does the patient get certified for medical marijuana? So we have to do what I find when I do these presentations. If we go right into the meat and potatoes of medical marijuana in cancer patients, we're doing all this backtracking. Wait a second, where'd this come from? How does this work? What is that? So you guys will have to bear with me to do the education. I like to do the education on sort of the beginning there so that when we get into medical marijuana, you're all well versed on what medical marijuana is, how it's different from other products, and the science sort of behind it. So, I'll tone it down a little. I won't make it, really in depth, but I think it's important to understand that. Okay. All right. So marijuana. What is marijuana? Marijuana is a plant that you're all probably familiar at this point. So, we're Homo sapiens, our genus and species, right? The genus and species of the marijuana plant is Cannabis sativa. Now, that was formally named in 1753. I like to go with these pop culture references. People talk about it: weed, pot, reefer, grass, dope, Mary Jane, whatever. So the most important thing is to know that it's a plant and the genus and species is Cannabis sativa. And we'll get into why that's important in a minute. That's the picture of the plant that actually grows. That is a leaf. That is not what is used in the actual marijuana products. It is more the bud that flowers off the female plant. Now, Cannabis sativa is a hemp plant, as that states, indigenous to Eastern Asia, and then it's been cultivated throughout all of the continents now. It's dates back 5,000 years ago. Chinese emperor used it for arthritis, malaria. It's even in the pyramids. They used to call marijuana shemshet back then. Ancient historical uses, if you look into anything about it, they used it for the fiber, the textile, and medicinal purposes. Present day industrial fiber, still seed oil, food, recreation, religious, spiritual ceremonies, and medicine. Now, Cannabis sativa, once again, I said it was a hemp plant, and we're going to get into a little more specifics on that. So there are over 500 natural compounds in the Cannabis sativa plant. When you really get into the detail about it, that's how we really very, very focused treatment when we get into the other compounds. We're going to just touch on the broad-based stuff to give you guys a general idea of how this works. So the two main compounds, molecules in the marijuana is the THC molecule and the CBD. And I think those are the two molecules that most people are familiar with, have heard. Now, here is the thing that is really funny that a lot of people don't understand. So everyone thinks that hemp is a cousin to the marijuana plant. It actually is not. Hemp is Cannabis sativa. I always get that look when I say this. Hemp is Cannabis sativa. Marijuana is Cannabis sativa. They both have the same genus and species. Everyone says, no, I've seen a hemp plant. It didn't have bud. Well, if they were growing a hemp plant for the fibers, they don't care if it's a male or female plant. If you're growing it for the bud to use that for a specific reason, yes, hemp will have buds on it. So the only thing that defines hemp as hemp and marijuana as marijuana is a federal law that states the potency of the THC molecule. If it is less than 0.3%, it is hemp. If it is 0.3% or greater, it's contraband as marijuana. So it's really funny because people say, no, I use hemp oil. Well, you're using Cannabis sativa oil. It's a federal law and a potency range that tells the difference. So The reason why I like to get into that is because I will touch on the over-the-counter products and the regulation in that field, or the amount of no regulation, and what usually is the issue with the over-the-counter type products. Now, marijuana is considered Schedule 1 contraband still federally. Um, they are actually having a hearing on December 2nd. The DEA has finally listened to the Health and Human Services Department in our federal government and said, you need to look at the literature. There are now 40 states that have medical marijuana going back 30 years. California was the first state that did this in 1994. So medical marijuana is in 40 states plus DC. 26 have recreational, whatever someone's opinion is of that. But in April, the Department of Health and Human Services went to the DEA and said, you have to look at all the information we have now, 30 years, 40 states. A Schedule 1 contraband is a substance, whether natural or synthetic, when introduced to the human body, has physical or mind-altering properties and has no medical value. That's a Schedule 1 contraband. Now we have Schedule 2 through 6 drugs, which are controlled substances, opioids, sleeping pills, whatnot. They want to reclassify marijuana into a Schedule 3 drug. That will not make it a recreational thing throughout the country. Schedule 3 is like Tylenol with codeine or sleeping pills. You can't go buy that over the counter. You would still need a prescription, but it won't make it contraband. And they reviewed all the information. They put it out for public comment on a website. They got 44,000 comments through July and August. They reviewed the comments and they say, we think it has the potential to be stated as marijuana has medical value. And they're having a hearing December 2nd. So this may change. Okay, so how does marijuana work in the body? It interacts with a system called the endocannabinoid system. Marijuana is the cannabis sativa plant. Endo means inside, cannabinoid system. So this system is a system that contains molecules and receptors found in all mammals, dogs, cats, cows, humans. We all have an endocannabinoid system. That's why this plant is here for mammals, to get this plant into their body. We have this distributed throughout all tissues. It's not just like one organ system, like you would have your pulmonary system, your central nervous system. It actually overlaps in all those systems. It's a pretty unique system with respect to what you can do by stimulating it, because you stimulate so many body areas. So it has a lot of different biological processes and physiologic roles. We'll get into those in a couple slides down the line. Now, it is stimulated by natural molecules. We have natural molecules in our body that will bind to receptors and stimulate this system. And then we have exogenous ones that we put in from the outside that we get from the marijuana plant. So it was really interesting how they discovered the endocannabinoid system. So they knew marijuana had some kind of properties, did something inside the body. Like I said, it's in the ancient pyramids. Well, it wasn't until 1963 that a scientist named Macolian said, I want to know what molecule is in that marijuana plant that makes people euphoric and high. And what he did was he broke it down on a molecular level, compared it to hundreds of plants, maybe thousands of plants. And that was the only plant that contained that THC molecule. So he isolated the THC molecule is what does it. Well, then it took 20 some more years till the late 80s, where a male and female biochemist said, no, wait a second. If THC interacts with something in the body, why is that system even in the body in the first place, right? Why does it grab this THC molecule? And they found the endocannabinoid system. So it's really funny. Present day, I think there's only about 15% of medical schools that teach the endocannabinoid system. And when I went and sat for this license, I came home and I said to my wife the first day of classes, I said, I thought this guy was mispronouncing the endocrine system. I said, if this is all hocus pocus and a theory, I said, I want nothing to do with it. And she goes, what do you mean you never heard of it? And I said, you ever hear of it? My wife's a registered dietitian. She's like, no, I never heard of it. And I said, yeah, I don't think it exists. She goes, just Google it. So she finally talked me into it. I Googled it and all these articles popped up, National Institute of Health, JAMA. And then I was a little mad that I thought I got a little ripped off. I went to medical school and I didn't learn about this system that's in the body. So I started reading on why medical schools didn't teach it. So it was interesting. So prior to California in 1994, if they were teaching physicians, medical students about this system, and if you felt so compelled that a person needed to stimulate this system, you would tell them to go get marijuana and use it. And it was contraband. So we take an oath to do no harm. So in other words, I can't tell you to go do legal harm to yourself either. So that's why they actually kept it out of medical school. So it's sort of interesting. So this is an illustration of the endocannabinoid system, two main receptors. It's in the central nervous system, it's in the GI system, it's in our bones, it's in our muscles, and our joints, and our nerves. So it overlaps many organ systems in the human body. So very unique. Now back to the endo part. So the endocannabinoid system, internal, that's what endo means. So not to get too clinical scientific here, but these are the two molecules that we naturally produce through our diet, anatamide and 2-arachidonoglycerol. These are the molecules that float throughout our body, interact with this endocannabinoid system to stimulate it and give us relief. Problem is, these molecules are not very strong, and we can have conditions physically, emotionally, where these molecules cannot actually help us. Now, CBD, cannabidiol. This is the non-psychotropic. It does not get people high or euphoric molecule found in cannabis sativa. Now, the problem with CBD is it doesn't readily bind to these receptors alone. It really needs to have THC present, and then it has a higher affinity to bind to these receptors and actually stimulate the system. So you can see pain-killing effect, anti-inflammatory. It can reduce anxiety, help nausea, help with seizures. There really is not a downside to CBD. It doesn't have a lot of side effects when it's introduced to the body. The problem is it doesn't really activate the endocannabinoid system when it is alone. And we'll get into it in more detail a couple slides down the line. So one of the main things that it does is when CBD is present, when THC is also present, it will block any of the euphoria which people can get high or euphoric from THC molecules when they're unopposed. So it will block or minimize the THC's effect, which is the psychotropic molecule, which is on the next slide. Now, the THC, I put delta 9. It has 9 carbon bonds. And the reason why I put that on there is because I get all these questions about what's delta 8, and we will get into what's delta 8. All those neon signs you see at all these places. We'll get into that. Now, THC binds very easy to the endocannabinoid system. There's a real high affinity, meaning those receptors will bind it. Once THC is bound, then CBD binds a lot easier. It actually changes the second receptor once THC is bound to the first receptor and helps CBD to bind more readily. So, pain-killing effects, anti-inflammatory, relaxes muscles when it's bound, helps with appetite, nausea, sedation. It can cause euphoria when it's unopposed or in excessive amounts in the body, meaning getting high, right? Euphoric, getting high. It can cause people to be paranoid, tachycardic. You can even get anxious. And then I put some adverse effects. You know, you don't always necessarily want appetite enhancement or sedation. You want those at the appropriate times, but it can be an adversity if someone's not trying to enhance their appetite. But all marijuana doesn't only enhance your appetite. There's actually ways to suppress appetite with marijuana. So let's get into some of the specifics of these different receptors in different body areas and what they actually do. So in the brain and central nervous system, when these receptors are stimulated, the receptors in the endocannabinoid system, it reduces pain, inflammation, spasticity, tremor, abnormal brain impulses, seizures. It'll help mood, sleep, appetite, nausea, vomiting, energy, metabolism, focus, and mental alertness. So this is everything it can do in the central nervous system and brain. Now, The problem, once again, with this system is anandamide and 2-arachidonyl glycerol, the two natural molecules, they're not very strong. So if you have pain, your natural molecules are trying to help with the pain. They really can't pull it off. You still have pain. Well, when you add THC and CBD, they're so structurally similar, they will bind to those receptors. Our body actually prefers to bind those in our natural molecules. We call that higher affinity. If your natural molecules are already bound, THC and CBD will push them off and bind. And when it binds there, it supercharges the system. You will get 50, 100 times greater symptom reduction than your natural molecules can attain. So in all these areas, you will get that added benefit when you energize the system with THC and CBD. In our peripheral nerves, you have pain, inflammation, hyperexcitability, irritated nerves, pinched nerves, things like that. So it can reduce that in peripheral nerves, musculoskeletal, and smooth muscle. So pain and smooth muscle is bowel. So it can help with pain, inflammation, and spasm. Inflammation, like in inflammatory bowel conditions, Crohn's, ulcerative colitis. We'll get into all the diagnosis. And then synovium in your joints, pain and inflammation. It can actually reduce intraocular pressure, the endocannabinoid system, when it's stimulated enough. A lot of the ophthalmologists and optometrists don't believe it until you actually prove it to them. So what a lot of patients do is they go in and their pressure is high. And then they say, can I go out to my car and I'll come back in 20 minutes and my pressure will be lower. And then they come back in and the pressure is significantly lower. 15, people will get well under 15 without any problem, even in optimal ranges of 10. So, and then in our immune cells, it actually helps to boost our immunity and also help inflammation in those areas.
Is he smoking now? He smoked it.
He smoked it because he didn't want the office to sit there and wait for him.
Right.
So once again, we do all these different things and we sort of sensationalize the recreational stuff to sort of keep it light and make a joke. So we do these promotions with all of the referral offices that send me patients. We'll go during different times of the year and we'll deliver them different treats or whatnot. So this is the husband of one of my employees. So he is Captain Cannabis. And what he does is he goes to all our referral offices and delivers. I have chocolate molds that are shaped like marijuana. And he goes and everyone thinks there's marijuana in them. It's really funny, which is not. But people really look forward to seeing him and getting these treats. So once again, we keep it sort of joking. All right. So medical marijuana, what is it? So recreational marijuana versus the over-the-counter products versus medical marijuana. So this is very important. This is one of the things where I get backtracked on all the time, and that's why I really like to cover this up front. So recreational marijuana, they grow that to get people high and euphoric. Actually, I was certifying a guy and he said, no, they actually grow it to make money. If it didn't get people high, they wouldn't buy it. I said, you're probably right. So how they do that is they clone and cross-pollinate the plants. They eliminate all the CBD. Recreational marijuana is THC only, and it's a lot of it. Now, what did we learn? When you have THC alone without CBD present, it will make you high or euphoric. It will stimulate the endocannabinoid system. You'll get relief. You won't be in pain, but you'll be high as a kite. So that's recreational marijuana. Not to mention, recreational marijuana is how medical marijuana started. And that's how I got interested in this. Patients would go to their doctor and say, I just want to be honest with you. I'm smoking marijuana. I'm not doing it to get high. It might get me a little high sometimes, but it's the only thing that gets rid of my migraine. It's the only thing that gets rid of my premenstrual syndrome for the week. It's the only thing I can sleep with. So doctors started paying attention to this. And, I had a really good relationship with my patients in my regular practice. And I had many patients, working people, professional people potentially could have lost their license for something if they would have got a drug test and it showed that it had THC in there. But they're like, it's the only thing that works for this. It's the only thing that works for that. And that's when I started following it in other states and their programs. And, that's how I got interested. And I almost bailed when I thought he was mispronouncing the endocrine system. So let's talk about the over-the-counter products. The high majority of the over-the-counter CBD products are at best, we'll get to that, at best CBD alone. Okay. Now, CBD comes from the hemp plant over the counter because the only things over the counter can be derived from plants that have less than 0.3% THC. It's still cannabis sativa, but it's hemp, right? Marijuana is the federal law, greater than 0.3%. So when people use CBD alone over the counter, there have been a couple different news outlets, media outlets that went and took a dozen of the most popular CBDs off the shelf. No regulation. There's no regulation in vitamins, supplements, any of that. They sent it to independent labs. The most recent one I saw was Inside Edition, that Lisa Guerrero. Yeah. She took 12 of the most popular ones she could find, all different price ranges. 10 of them had no CBD at all. None, because there's no regulation. One of them had 5% of what was supposed to be on there, and the other one had what was supposed to be on there. It was probably that Charlotte's Web one. That's the one that's got the best name over the counter. So what I'm saying is the high majority of people using CBD over the counter aren't even using CBD. But the problem is, even when you use straight CBD, it's probably not binding to this system because there's no THC present. So the highest majority of people, whether there really is CBD in there or there is not, it's probably a placebo effect. And the placebo effect is powerful. When they do regular drug studies, 5 to 10% of the people will get a placebo effect that's close to the actual drug that they're testing. So, I don't mean to burst anyone's bubble. If the placebo effect works for you, that's great. You're not hurting yourself at all. You're just not really getting the benefits of what you thought that the product was supposed to do. Now, what is medical marijuana? So medical marijuana are products that are produced from the marijuana plant. So usually greater than 0.3%. They do make some lower potency ones, and they do it on purpose. So the high majority of medical marijuana products, and most of the ones that I recommend, are THC and CBD containing products. Once again, you need THC present to really stimulate the system. You don't need a lot of it. You just need a little. And when we put the CBD with it, remember, it blocks the euphoria. So you do not get high or euphoric. And the CBD does another thing too. It actually enhances the symptomatic reductions that you get over just using THC alone. So say someone's pain level was 8 out of 10 and they used a certain marijuana product with THC only in it, and it reduced their pain from an 8 to a 3 on the numeric rating scale. Then you take that same THC molecule, add CBD to it, and maybe they got their pain down to a 1. So it gives an added benefit over just the symptom reduction that THC alone gives. So there are some all THC medical marijuana products too. Don't get me wrong. Everyone's body, if you remember that slide I showed that showed CB1 and CB2 and all those receptors all over the body, THC binds to the CB1 receptor, CB2 binds to the CBD binds to the CB2 receptor. Some people have all CB1 receptors and they get no benefit from CBD at all. And it's very hard for that person to get euphoric and high. It's very interesting. People say, I'm naturally tolerant to it. No, you just have a lot of, well, you are, but it's because you have a lot of CB1 receptors. When you saturate the CB1 receptors without CBD present, that's how you get high. So when someone has a lot of CB1 receptors, they can use a straight THC product and not get high or euphoric because they didn't saturate all the receptors. So I hope that's not a little too much when it comes to that. So once again, we introduce the two molecules into the endocannabinoid system, THC, CBD, and we can accomplish all these things. In the central nervous system, we can help with energy levels, focus, mood, sleep, headache, head pain, abnormal brain discharges, seizures, tremor. Then in our peripheral muscles, nerves, joints, organs, bones, we can help with pain, inflammation, muscle spasms, irritated nerve endings, neuropathy. And then in the GI system, we can help with GI upset, nausea, overactivity, diarrhea, general pain. And marijuana can enhance appetite and it can suppress appetite. And it all comes from, remember I said there was 500 other compounds in there. There are other compounds that enhance marijuana or enhance appetite, and there are other compounds that actually suppress the appetite. So we can actually help people to lose weight using marijuana. Now, there are three main strains. Oh, let me go to that other point. So once again, the goal of medical marijuana is to give someone symptom reduction, stimulate the system without having the euphoria or without having someone get high. And it's really funny because the high majority of people that I certify, if they're 70, 80 years old, whatnot, they'll say, hey, back in the 60s, I had a different goal using marijuana than I do now. And I said, I got the right product for you. You'll be fine. Just on another note, my youngest patient is 6 months old, and my oldest patient is 97, and I have a 100-year-old on deck that wants certified for arthritis. So marijuana, the cannabis sativa plant, not to be confused with the strain. So I like to say roses might have red ones, white ones, yellow ones. The cannabis sativa plant grows in three distinct varieties we call strains. There's a sativa strain, there's a indica strain, and then there's one in the middle called a hybrid. They all have unique characteristics at a baseline just based on the strain and nothing else. So for example, the indica strain, we joke and say, how you remember you use indica at night is we joke and say, indica in the couch. That's the one that puts you to sleep. The sativa strain is the energizing strain. And we joke with that one and say, you remember that sativa up. That one boosts you up, gives you energy. Now, the hybrid is a natural cross pollination between sativa and indica. It's sort of how they make pink rose. Take a red rose, a white rose, cross pollinate, you grow one in the middle. So the indica is sedating, mentally relaxing, reduces anxiety, gets rid of pain. The sativa strain gives you energy, gets rid of fatigue, elevates blue mood, right? So what happens when you cross pollinate those two is the energy that the sativa gives you overpowers the sedation of the indica, but not by a lot, just enough. So it's energy neutral, it gives you a little energy. But the hybrid and the indica component of it, the indica component of the mental relaxation is much stronger than the mood boosting of the sativa. So you get mental relaxation, a little energy, and you get all the pain benefits. Where we see the two used is a patient with underlying depression predominant or underlying anxiety. So obviously the blue mood depressed person, we use a sativa product. When we have someone who's anxious daytime, we use the hybrid. The old recreational story about I smoked a joint in college, I got so nervous and paranoid, I hid under the bed and shut all the curtains. That is someone with underlying anxiety who smoked a sativa marijuana because that's where the paranoia comes into play. Two things with the paranoia. You don't need a lot of the sativa strain to make someone with anxiety super anxious, paranoid, panicky. And excessive THC in general, no matter what strain it is, can make people paranoid. So now let's go into all of the forms of medical marijuana. We do not have snack food specific type products. It's actually forbidden in the law. Our legislature was, they were sort of stuck on the fact that a child can put a Tide Pod in their mouth, let alone a bag of gummy bears with marijuana. I have my own opinion on why an adult needs snack food type medicine. That's just my own personal opinion. But the number one request of medical marijuana card holders year in and year out to the state program is they want more edible options. So, like I said, to me, I can understand you're sick of taking pills, but then again, like I said, you think of a child getting a hold of this. Now, marijuana is not like an opioid or like a benzodiazepine like Valium. It doesn't shut your breathing off. Marijuana ingestion, excessive ingestion or excessive inhalation can't kill you. You would either be excessively high, excessively tired, or you would throw up. And throughout all of the states, the 40 states that had medical, 26 have recreational, there has not been a serious adverse issue with a child getting a hold of a marijuana product, just to state a fact. So we have the fully ingestible category of medical marijuana products. So that is capsules, tablets, oils that you mix in with food, and a syrup. Now, when you ingest into the belly, that is the slowest onset of action. It's a minimum of an hour. Most people, it's not until an hour and a half. There's a lot of people, it's not till 2 hours. It's a long time to wait. People get frustrated with that. The the ingestible products is the other funny recreational story because people aren't familiar with that late onset. So someone goes to a party and says, I took a bite of a brownie. I waited 15 minutes. I didn't feel anything. Everyone else is feeling it. I took another bite, 15 minutes. I still didn't feel anything. Ate the whole brownie. An hour later, still didn't feel anything. Ate half the pan. And at 2 hours, when it kicked in, they were stuck on the couch for 12 hours. So, oral completely gastric absorption products, not my favorite for multiple reasons, because people tend to get antsy, but waiting. It wasn't strong enough. And then it's a little unpredictable. So some days you take it, empty stomach, same time of the day, you take it and it kicks in an hour and 10 minutes. And the next day you take it, it's 2 hours. So it's just not predictable. It's slow onset. The length of action is the longest. It can be 8 to 9 to 10 hours. True gastric absorption products you swallow over your belly, like I said. Now, the other issue is, even though it can help nausea in the long run, sometimes people who are nauseated who do gastric absorption products, it can actually magnify the nausea before it helps it. Okay. Now, the oral absorption products, these are products that dissolve and absorb in the mouth. So we have sublingual drops, we have a buccal spray, a mucosal spray, and then they sort of found a way to skirt the law where it says you cannot have gummies, cookies, candies, chocolate, whatever. So there's an old medication form called a troche, and it's just something that dissolves in your mouth initially. So what they did was they came out with a soft gel troche, which is essentially a gummy or a gumdrop. And they waited till about 4.5 years after the program was out. And it was really funny. And they have another one called a mini troche, which is like a mint. So I had a patient that I was recertifying, and the patient said, I go, oh, what form are you using? You're still using the drops? Well, I use those gummies now. And I go, gummies? What do you mean? You going to New York, or what are you getting gummies at? No, they got them at Rise. And I go, they don't sell gummies there. Yeah, they do. They started selling them a week ago. So it was funny. He left, and I went and looked on the computer, and there they were, right? So I called up there and I said, hey, what's going on? They're like, well, we're sort of doing like a soft launch of this because we didn't really ask the state if we could sell them. Okay. But a year and a half later, and there hasn't been any problem, and people love them. And now they're ringing off the hook, really even more. They want more of the oral absorption, the universally known edibles. But just real quick, another funny story, how I never will ever not believe a patient to look something up. So I had a paranoid schizophrenic patient that followed me from residency. He's one of my oldest patients I ever had. He followed me into regular practice. And he was a bad vascular path. He was on Plavix. So he calls the office, and he would call all the time. So all the staff knew him. His first name was Marvin. So my MA comes to me and says, hey, Marvin's on the phone. He won't get off the phone. He wants to know why you changed his Plavix to generic. Well, Plavix wasn't generic. It still had 2 years on the patent. He was convinced the pill's color was a shade off and it wasn't the exact size. It's going on and on. He's not going to take it. And this guy's a bad heart patient. So I get on the phone and he says, these pills are blah, blah, blah. And I'm like, okay, I'm going to listen to a paranoid schizophrenic. I'm the doctor here. And I'm going to call the pharmacist, right? So I call the pharmacist, 9th and State. And I said, hey, you know Marvin? Who doesn't know Marvin? He says. I go, he's on the phone saying you gave him generic Plavix. I did. Right? I said, what do you mean you gave him generic Plavix? It's still got 2 years on patent. No, a company infringed and we have to give it out. And they won't stop producing it until there's an injunction for them. So they figured they could get it out there. There's so many people on it, they could make so much money that they could still pay the lawsuit off. So when a patient tells me something, I don't care what it is, I will never not believe you. I will always look into it because Marvin taught me that. Even a paranoid schizophrenic knows more than the doctor sometimes. So now the oral absorption products, they flavor all those, the drops, the sprays, the soft gel troches, and the minis. They flavor all of them. They taste good. They dissolve and absorb in the mouth 60 to 90 seconds. They take 20 minutes to a half hour to take effect. So very predictable onset, not too long to wait. And the length of action is 6 to 8 hours. Very appropriate for multiple things. Most people do not need more than 8 hours sleep. And as we mature, we even need a little less, right? So the problem with taking the pill form is that can last 8 to 9 to 10. Well, sleeping over 8 hours can actually be counterproductive. If you get through 2 sleep cycles in a night, wake up, that's it. You're not supposed to get into a 3rd sleep cycle. So if you're a 3.5 hour sleep cycle person, 3.5 hours, a little bit awake, go back to sleep again. Get up. No, I'm gonna go back to sleep another hour and 45 minutes. Now you're in your deep phase of sleep of your 3rd sleep cycle, and you will be tired for several hours. So, the old adage is too much sleep can be a good thing is actually true. And that's what the capsules and tablets, they give you a little too much sleep. The sublingual is a better way because it gives you 6 to 8. Yeah. Now, there are the inhalation products. So there are the flower forms, the old-fashioned bud. The young generation has renamed it flower, not to be confusing. From a true botany standpoint, a female plant actually produces a little flower before it produces the bud, so they call it flower nowadays. And then they have the vape cartridges, pens, which is an oil that's inhaled. They have other concentrates and different things that are really potent. The vape products take the marijuana smell out. So if you use a vape, there is no smell. They're very discreet. It's not like these nicotine vapes with all this big plume of exhale. If someone was even in a room smaller than this and they pulled out a vape pen, did an inhale and exhale, no one would have seen or smelled anything. I mean, they're very discreet. They are the fastest acting forms, right? Inhalation, literally 5 minutes. Some people say they can feel it in 3. So, you see a lot of the inhalation products where people want immediate relief and they can't tolerate anything in their mouth. Maybe someone's so nauseated, even putting one of those soft gels in their mouth.
Somebody around you.
They can get a contact, so you do have to stay away. They look at it as the law. If you were doing a vape and someone felt funny, it'd be no different than if you shared a pain pill with them. So you got to make sure that nobody can get a contact off of that. But it works excellent for where I see most of the inhalation, is especially with cancer patients, is the nausea because it's so fast. I see it a lot used with PTSD patients. When they're in a PTSD event, they want immediate mitigation. Also, migraine headaches. They like to nip it in the bud as soon as they feel that headache coming on, so it doesn't ramp up harder to get rid of. You can use any of these forms for any condition, but like I said, these are just sort of the pearls of, where they tend to work the best. Now, there also are topical lotions and patches. The lotions work great for local areas of pain, works better for musculoskeletal pain than organ pain. I do have some people, though, that do put it on when they have organ pain, but the lotions are really impressive. I probably get not quite a call a week, maybe 2 to 3 a month. I get people who stumble upon the lotions. They go over someone's house, and if someone has a bottle of drops there or lotion, they're not going to take the person's drops, but they'll be like, I got a sore rotator, I got a sore tennis elbow. And they'll rub it on. They get so much relief. They'll call me the next day and they'll say, I put my grandfather's knee arthritis on my partially torn rotator. I slept all night. I want certified for the lotion. Like, you get educated and certified on everything. If you just want to use a lotion, that's fine. And I do have dozens of people who literally just use the top, probably hundreds at this point, to tell you the truth, that just use the lotion. Once again, mostly chronic pain stuff. There is a patch system. The patch system can be used twofold. It can be right over direct and area pain, but it also can be used in more vascular areas to actually help get a systemic absorption of the product. The problem is they're just not real refined enough. Sometimes you can use the same, you can take a patch, cut it in 4s, use the same patch in the same area and get quite a different effect from it. So they're just not refined enough, not my favorite way to do it or recommend it. And then there is suppository forms. That's usually for people who can't swallow. Throat cancer is one of the people who can't swallow, obviously, and those are people who don't want to inhale, and they use a suppository form. I do have 3 or 4 patients that use suppositories that don't have a swallowing problem. They have an unrestricted license. They can do whatever they want. You can go buy a Tylenol suppository if you got a fever, right? But you can also just take a couple tablets. So, all right. So let's get into the specifics of benefits to a cancer patient, right? So obviously nausea reduction. So, nausea can be from treatment. It can be from pain. It can be from the actual cancer itself. And as we talked about, those endocannabinoid receptors, the ones in the central nervous system and the GI system, both will help the nausea. Appetite enhancement, significant issues with weight loss and appetite. And we'll get into the ramifications of that down the line here with the slide with the appetite, poor appetite and weight loss in cancer patients. So it can help with pain reduction, just help people to be more comfortable, whether it's musculoskeletal, soft tissue, joints, bones, nerves, organ pain. Then mood enhancement, we can elevate blue mood, we can reduce anxiety. A lot of cancer patients have mood derangement, which is completely understandable, just from hearing the C word alone, or we do know that chronic pain can cause significant amounts of depression. It can actually improve sleep, which is very important for a cancer patient. You need to sleep for multiple reasons. Your body needs to go into repair mode when you sleep to heal your cells. You also need to quit bursting cortisol. Cortisol feeds tumors. And when we do not sleep and get well-rested sleep, every time we wake up, we're bursting cortisol. So sleep is seriously important for more than one reason, not just to feel well-rested, but for the body to do its normal circadian physiologic processes of healing and stopping doing processes that's meant to be when we're introducing wake time into our body, the rigors of our day, inflammation, whatnot. So the immune system enhancement, like I said, the receptors are on immune modulator cells that actually can help boost the immunity. As most people are aware, people receiving treatment are immunocompromised, as we say. So I'm not saying this can necessarily counteract, but it could definitely help to give people a boost and maybe prevent a couple of things here and there. And then the anti-fatigue properties, whether it's the disease state, whether it's the mood caused by the disease state, or whether it's the treatment, whether it's poor nutritional status, the anti-fatigue properties of that sativa strain, right, the one that boosts you up, can give patients a significant benefit. Now, so these are the specific things in an active cancer patient. So where we see it reducing nausea and vomiting and helping appetite. So that will help you to stay hydrated. Now, if your labs get off and you are dehydrated, a lot of treatment has to do with getting filtered through your kidneys. And if you're having a little dehydration and your kidney number is a little off, they will delay treatment. So by getting rid of the nausea, patients will tell you, I can't even tolerate water in my mouth when they have some of these different chemotherapies and immune therapies. So if you get dehydrated, they will temporarily delay. And it can be dehydration on physical findings or through your blood work. And that's why they do blood work all the time. So with respect to the appetite enhancement, so you need to maintain an optimal body weight that will keep you strong. A lot of people think, well, if I'm just losing weight, I'm losing extra calories, I'm losing adipose tissue. No, you will lose muscle. You'll lose muscle mass, and that's strength. Now, if you're too weak, if you're having issues and become frail, or if your BMI drops below a certain point, they will stop treatment. They will delay treatment, or you will have treatment cessation. They will say, no way, we are not going to continue. So if you can keep your appetite up, you can keep eating, you can stay at a minimum BMI for them to continue treatment. That is very important. So the pain reduction, right? So as we discussed, you have pain associated with the disease state, you have pain associated with the treatment, and you have other non-cancerous pains. You know, you could already have had a bad back, and now you have renal cell carcinoma. Now you have stomach pain too. So, you know, it can help with all of those different amounts of pain from any etiology. So the sleep thing again. So back to the body to re-energize, right? You sleep, you feel better in the morning, you got through a good night's sleep, you have more energy just to take on the day. But healing physically and emotionally, you need to shut the central nervous system down. All the stress from your day and thinking about your disease state and your kids and everything else. You need to get in a deep phase of sleep and you need to shut it down. And it will significantly help you to be able to take on your day the following day. The anti-fatigue properties. So, you know, some people just get so exhausted, they're just like, forget it. I don't even want to get up and get out of the house. Well, if you don't get out of the house, you're not getting your treatment. They're not going to come and do it in your house. So it's very important to have the energy to drive. So that last statement there, the bottom line is the niche for medical marijuana in a cancer patient is this can give you the potential to stay hydrated, stay well nourished, stay in the right frame of mind, get a good night's sleep, have energy, boost your immune system so you don't contract different illnesses that could also stop your treatment. Your best chance for cure remission is to get the maximum dose, the maximum recommended dose of your treatment at the recommended schedule. Why? Because they know that works. And how you can do that is by staying well hydrated, well nourished, sleeping, staying in a good disposition, have energy. So there's some stuff out there, and I had a handful of patients try this. So there is some information out there that marijuana can be cytotoxic against cancer cells. So there is a botanist chemist named Rick Simpson. And if you read it, it's Rick Simpson oil. He found a way to extract, and they sell Rick Simpson oil at the dispensaries. It's a way to extract marijuana in a very potent small package so you can get a lot of it in your body and not get full, because you have to ingest excessive amounts of this in order for it to work. It's very expensive. It would end up being a couple $1,000s a month. And it's something ridiculous. It's like in 60 days, you have to ingest 90 grams, 9,000 milligrams of marijuana. So I get patients who've tried it, a handful. 2 guys were prostate cancer, 2 of them were glioblastoma, 1 was pancreatic cancer that I can recall. So in medicine and in evidence-based medicine, we know several things, right? We know what works from the studies, right? And we know what doesn't work. And then there are things that we just don't know about, right? We can't make a comment because we just don't know. So what I've experienced with that, and never have had someone tell me, yes, I'm the one who did it and my cancer was gone, I'd have to say that that's leaning more towards it doesn't work, because the patients who tried it, it didn't work. The PSA numbers kept getting worse. The glioblastoma kept getting bigger. So that probably is somewhere between what we don't know and what we know doesn't work. So if you read that, and I don't give anyone any panacea when they call me about that, I tell them straight up, most people can't tolerate that much, first of all. Second of all, if you were to try a lesser schedule, that's not what Rick Simpson says works to begin with. So if you can't do the full Monty, why would you even try it? So, like I said, there's this information out there. There's a lot of Bigfoot stories about that. I'm not completely knocking it. I'm just saying it's somewhere in the realm of we don't know to we know it doesn't work. Okay. It definitely needs more research. And if they take marijuana off that Schedule 1 contraband list and make it a Schedule 1 drug, there will be more major studies and major medical centers that will be taking it up. The problem is with research, there's really only 2 ways that drugs get researched. You got the private sector, right, the pharmaceutical companies throw billions of dollars in R&R to make billions more. But the problem is this is a plant. You can't get a patent on it. So they have no interest in it. Well, the National Institute of Health is who funds the majority of the non-private sector studies. Well, the National Institute of Health is a federal entity. So if they start throwing money at marijuana research, people are going to say, that's what you're doing with our tax dollars, giving it to devil's lettuce, right? You know what I'm saying? So, but if they make it a Schedule III drug, I think we'll see that change significantly with the research, which definitely, needs to be done because we're really in the infancy of this, right? We even take medicine back to the Egyptians, the Romans, not even marijuana. I'm just saying real medicine, right? So if you really think about this, Napoleon in 63, then the late 80s, the other two, and then we just knew about the endocannabinoid system. I mean, this is really, cutting edge medicine. When you look at the vastness of medicine and how things mature and advance and go through generations, people are willing to take this on. It's non-FDA approved, right? It is a natural plant, but it's non-FDA approved. We have limited research, major scale research. And I truly believe that people will look back on this once we are able to study this. And the people who are early adopters of this, you'll be like, oh, I've been doing that for 10 years. I knew that because of my own trial and error with it, And I'm not trying to say this is nature's plant, nature's medicine, and it can do everything you want it to do. I'm not saying that at all. But what I am saying is we have this system in our body that we naturally produce two molecules that are very similar to the molecules that are in that plant. But when you put those molecules in the plant, it energizes the system above and beyond. There's a reason why that plant is here, and there's a reason why we have this system. So it's to enhance the ability of the system to do its job. So once again, the niche for medical marijuana is to give you the best chance for cure remission because it can potentially keep you in the best physical and emotional shape to take on your treatment. And it's really funny because when I first got the license, I sent letters out to all the doctors, and we'll get into all the different diagnoses. And I sent them all letters saying, these are the diagnoses I can treat that you see. These are the ones you see. These are the ones you see. Several of my first patients that self-referred were vets with PTSD. And then some cancer patients started trickling in. So it was really funny. I said, oh, how did you get my phone number or whatever? I sent business cards out to all the offices. And they said, well, my oncologist said they don't know anything about medical marijuana, but you sent them a letter and this card. Mm-hmm. So then I started certifying. I had a couple cancer patients self-referred. And then all of a sudden, I think they saw these patients doing the medical marijuana were doing a little better with being able to tolerate their treatment. And once again, not saying the medical marijuana is curing their cancer. No one's saying that, but it's giving the patients the ability to tolerate their treatment to the max doses and to the max schedule. So then the floodgates started opening. So my practice consists of 40% chronic pain referrals, 40% anxiety, and unfortunately, it's 10% cancer. And I'm really skewed with the national average. The national average is only 3%, but I get multiple cancer referrals every day from Hillman, AHN, Warren Cancer Care Center, Barco Center down in Meadville. Every day, the fax machine just goes off and it's a cancer patient. So my breakdown is skewed to what the state overall sees. And I think it's because of the direct referrals that I receive. So post-cancer benefits. So a lot of people will go through cancer and they'll still have trouble getting the weight back. And it's not just the fact of that they can't eat. As we mature, it is harder and harder to build muscle mass, right? If you want to put weight back on, you'd like to put lean mass, not just, fat, adipose tissue. But the problem is a lot of these treatments not only will break your muscle down, you're calorie deficient, you burn your muscles for energy, but it also bothers the nerve tissue. And once you kill nerve tissue, now you don't even have the nerve tissue to actually fire onto the muscle, to build the muscle, to put lean mass back on. So it can be tough to get back to, an optimal BMI. So, people say, well, the BMI, you always hear about that with respect to the BMI is too much, right? I mean, what's 70 some percent of Americans are overweight, right? Well, the problem with a BMI too low is you can't do all of your normal metabolic processes. So you can't maintain body temperature. If you don't maintain body temperature, you can get common illnesses all the time, right? 98.6 degrees, that fights off the bacteria and viruses we're constantly getting bombarded. If you do get a significant illness, you get a pneumonia, now you can eat. Your body's got to break something down for its own energy. If your BMI is too low, you got nothing to burn, you're not going to utilize the antibiotics they're giving you because you can't even produce an immune response. So there's many reasons to get your weight back to an optimal BMI after treatment. Pain reduction, right? General quality of life. You can have post-chemo neuropathy. You can have some kind of surgical pain if you had to have something resected. So to have ongoing pain and even non-cancerous pain, but the quality of life that it can give you. And, the other thing, to be able to escape your pain so that you're not constantly thinking about, your prior disease state or even, your remitted disease state if you're not considered cured. The sleep improvement, we touched on that. Quality sleep, physically and emotionally, what it does for you to get through 2 sleep cycles. Once again, the immune boosting potential. Once you're a cancer survivor, cancer's in remission, the last thing you want to do is stress your body. So what we're learning about immune therapies, right? Let's think about this. So immune therapy is pretty interesting. When you think about it, they're sensitizing our own body with an outside entity to attack the cancer. Well, what does that tell you? That tells you the treatment is already in here. We just don't know how to turn it on. I don't know if you can turn it on with your mind or however. Right now, we need an external agent to turn it on. So even though your immune system has tumor suppressor genes, and when your body is not stressed out, those genes are not active. But when your body gets stressed out from infections and exhaustion and overexerting yourself or whatnot, your goal is to maintain a healthy lifestyle to promote a strong immune system, especially how important that is nowadays that we know that there is a component of the immune system that can attack cancer cells. So, the bottom line is with this, the post-cancer patient is everything that medical marijuana can do. So, I get asked this a lot. You get certified with active cancer, but even if you're cured, once you've had cancer, you can use and be a medical marijuana patient for life. You don't, once you get cured, lose your certification. That doesn't happen. So, just to give yourself, good quality of life, to maintain your healthy weight, emotional well-being, pain-free, and for you to enjoy the rest of your life. So there's definitely a lot of benefits while you're actively treating, but the post-cancer treatment, there's a lot of benefits as well. So our upcoming promotion, everyone loves this guy. So we call him Cannabis Claus. Okay. Cannabis Claus does sugar cutout cookies that are shaped like marijuana leaf. That's what's in there. But yeah, they really look for him to come. I had to order that from Poland. There's some kind of green Santa Claus in Poland, but that's where I had to order that costume from. And if you notice, that Christmas tree is actually a marijuana plant. It's not a yeah. It was funny to find that. Okay, so let's talk about the certification process. So the first thing is that a patient has to be recognized as having a condition that qualifies them for medical marijuana. So once it's determined that a patient has a condition, then they have to call a certifying doctor, certifying office. So what the state requires is by law, the certifying office needs to get a paper copy of a diagnosis from a practitioner, physician, therapist, whatever's chart that shows the diagnosis that meets qualification. So those records can come from, my chart. Patients have access to that nowadays. We at my office have agreements with AHN and UPMC. We can just get an electronic medical records release and we can go into the chart and pull the document we need. And that makes it very efficient in our office. My girls are really good at that. So then the certifying physician has to review the record and make sure the patient has the diagnosis. We'll get into the list next of all the conditions. The one condition that is not on there is insomnia. And I get a lot of phone calls for insomnia. I can't certify you under insomnia. I can treat your insomnia, but I got to get you certified under something else. So then I interview them, chronic pain, you have anxiety, I come up with something else and say, well, we can get you certified because you have arthritis, get knee injections, and we can just treat your insomnia. If you want to use it for your arthritis, you can do that also. So once the record is reviewed, there has to be a presumption that the medical marijuana is going to help the patient. I'll see cases that I'll say, I really don't think this can help you. And let them have an informed decision if they want to move forward. Thinking of other cases similar to them I've had a very low success rate in some cases. Very rare, but I don't like to have people go through this process and do the out-of-pocket expense if I don't have a high degree of confidence that I can help them. So once the review of the records is performed, what I do is I call the patient to go over the costs. So when we have to really look and find a diagnosis and send out hard copy records releases, and I get the girl who hits the button out of the electronic chart and I get 800 pages on my fax machine, right? We got to go through, we got to shred all that stuff. When we don't have a direct referral and we have to chase records down, patients don't know who their doctor was, or they give us the wrong doctor's name. So a non-focused, non-referred patient in our office is a $250 certification visit. And that's complete education on the endocannabinoid system, coming up with a treatment plan, going over all the products, going over where all the dispensaries are, is normally $250. If a patient is direct referral, I get your records off of the fax machine, it's only $150. We don't have to do all that investigative work. Any cancer patient, I certify for only $100. My mother is a 19-year breast cancer survivor as of last October, and she had advanced disease, so she's doing very well. So any patient with cancer, I do the certification for only $100. It is not FDA approved, so the insurance companies do not pay for non-FDA approved treatments, therapies, medications. So that's why medical marijuana is not covered, because it's not FDA approved yet. And I think, as you could imagine, it's probably not going to get FDA approval anytime soon. Even if it goes to a class 3 medication, they'd have to do all these studies and then get it approved through the FDA. That would take minimum probably of 10 years. So it more than likely will not get FDA approval soon. Now, after a patient is certified for the office fee, the state license fee, they have to send you the ID card, the actual medical marijuana license card. That is normally a $50 fee from the state. That's paid directly to the state. The office visit fees paid to our office. The state gets the $50 for the license. If someone is in any form of state assistance, the state will waive the $50. So if you have Medicaid, not Medicare, Medicaid, medical access, if you have SNAP EBT, otherwise known as food stamps, if you have WIC, or if you have PACE or PACE-NET, they will waive the $50. Now, there is a dispensary in town that if you have a Medicaid card or a SNAP card, they will give you 20% discounts on purchases. 3 of the 4 dispensaries in town do a 20% senior discount, and 2 of them do a 20% vets discount. Now, the PACE-NET is a really cool feature with the program. If you have PACE or PACE-NET, you will get a $50 a month stipend to buy your medical marijuana. So sometimes I certify a cancer patient who's got PACE or PACE-Net. It only costs them $100 to get certified. Doesn't cost them anything for the license. And then the state, if you're a THC naive person, you're not self-treating, you'll be able to treat yourself on $50 a month without any problem. So those people have no out-of-pocket expense. And then if you don't spend the $50, it keeps on carrying over month to month. So PACE is a really cool thing for seniors. So that's nice. Now let's just talk about some of the costs of the specific products. So one of the most cost-effective ways to do this is the Rick Simpson oil, not the Rick Simpson, not doing his recommended dosing schedule, but Rick Simpson oil, you get 1,000 milligrams. It's a lot, and you can get that for $40 to $50 on sale. The problem with it is there's no meter dosing. It's in like a little insulin-looking syringe, and you take a little squirt of it, put it on a cracker, and eat it. There is no controlled dosing, and too much even of a THC CBD product can make you euphoric. And remember, the ingestion one can last for a long time. So even though 1,000 milligrams of Rick Simpson oil for $40, if you could portion that out in a 1 or 2 milligram dose, that would last you 500 doses, but it's very difficult. The tinctures tend to be the most cost-effective way to do this, the drops under the tongue. So you can get a bottle of tincture, 400 milligrams, and you can get that for like $50 regular price. Seniors, 20% off. You get it for $40. And that literally can last you 3 months or more. Where a person who's THC naive probably only needs a milligram of THC and CBD, sometimes even less than that. And I start low and slow. So I like the tinctures because you can keep moving up. 1/4 ml, 1/2 ml, 3/4. No tax on medical marijuana. So you pay the price you pay. And then they have sales, and the products, once you know what product you use the most, if it goes on sale, you just buy more. The soft gels, the gummies, you can usually get about a month supply, maybe a 6-week supply if you're just someone starting out, because you can cut them. They're usually around $25 or so you can get that for about a $20. But like I said, 4 to 6 week supply. People like those vape pens, $25, $30 that can last you 6 to 8 weeks. The capsules are the most expensive. For $25 or $30, you only get 20 to 30 of them. So that can be one of the more expensive ways to do it.
Do they ever expire?
They do, but they don't spoil and go bad like milk. They just may not be as strong as they would be. You just keep them. Most of the tinctures come in amber bottles. You keep them put away from direct sunlight, 50 to 80 degrees, and you can get at least a year out of your product. They won't tell you that because they want you to they'll throw it out and buy it if you don't use it, right? All right. So then after we go over with the patient all the costs, I want someone to have an informed decision. I don't want anyone to have a gotcha moment, because the $100 to give me is nothing if you're going to be spending 50 to, if someone, most people don't, but if you're a 50 to 75 month person, that's $1,000 throughout the year that you're going to spend. So I like to give, you have to recertify, correct, and the state. Yep. You get a 12-month card. Yep. So once I explain the cost to everyone, and then they make a decision if they would like to move forward and become certified. Now, here are all the conditions. So not just cancer. So MS, Huntington's chorea, any form of a neuropathy, any type of chronic intractable pain. So chronic pain, depending on who you read, is a minimum of 3 months or a minimum of 6 months, and it has to be on a numeric rating scale of 7 or greater out of 10 that is still present despite attempts to get rid of your pain. So when I have people who call me up and say I have pain and I'm not doing anything about it, you see what I'm saying? According to the way the law is written, you haven't had made attempts to get rid of your pain. And if you can't get rid of your pain and you still have pain, then you are a patient who meets the criteria for medical marijuana.
Can you be on other pain medication?
Yeah.
And get medical marijuana?
Sure. So it's a good question. So this is what happens with pain patients or even anxiety patients. So what I like to say is 1/3 of them, the goal of adding medical marijuana, obviously they're not completely satisfying their condition or symptom with whatever they're taking. So one of the goals with adding medical marijuana is to help your condition and give you the best quality of life. Well, 1/3 of the patients feel the best if they stay on all their regular prescription medicines and add the medical marijuana. They're like, oh my God, I feel great. I don't want to change anything. 1/3 of the patients are able to get off a few medicines to reduce their regular pharmaceuticals and add the medical marijuana. And I have another third of the patients who get off their medicines. You name it, I've gotten people off of it. Whether it's Valium, Ativan, Xanax, sleeping pills, oxycodone, OxyContin, Suboxone, methadone, you name it, I've gotten them off of it. But I don't like people to go in with that mindset. I'm going to get, no, the goal is to use everything you have in your arsenal, whether it's your prescription medicines, physical therapy, hypnosis, medical marijuana, whatever you can use to give yourself the best quality of life. That's what it's all about. So I don't like people to, get it in their head. I want to get off all my medicines. Tourette's syndrome, epilepsy or intractable seizures, anxiety, PTSD, HIV, AIDS, chronic hepatitis C. That was the latest one they added, was the hepatitis C. Inflammatory bowel disease, ulcerative colitis, Crohn's disease, sickle cell anemia. Sickle cell patients have pain crisis when their arteries get occluded by the sickle-shaped cells. Spastic and dyskinetic movement disorders, restless leg even falls under that. Different types of motor tics. Neurodegenerative conditions, Parkinson's, dementia, ALS. Someone asks me all the time, well, what does it do for dementia patients? Well, that sativa product can give them a little bit of energy and focus, and sometimes can help them have a little more clarity than they would normally baseline. It will not slow dementia down. It will not stop dementia, but sometimes it can help them use areas of the brain where they haven't had access to. And then the agitation and the sleep disturbance with dementia patients is where we see the indica help a lot. ALS patients, obviously you can get certified. Any damage to the central nervous system, stroke, severed spinal cord, motorcycle accident, autism, certify a lot of autistic children, cancer, and I put including remission therapy, any terminal illness if you have less than 1 year life expectancy, glaucoma, and then opioid use disorder. Okay. So the exact process, once it's determined and you decide you want to move forward with a medical marijuana certification. So what we do is we send an email to the patient, and you have to get registered on the Department of Health's website. They have the medical marijuana registry. We have a lot of patients that don't have computers, don't do emails. And what we do is my staff will just, it's a complimentary service, we'll get you registered. But what we normally do is send the email to a patient, and it has the link to the Department of Health's website. It's a 10-minute process. It's basically a demographics page, name, address, phone number. Now you have to have a Pennsylvania state ID or a Pennsylvania driver's license, and you have to have a mailing address, and you have to reside in Pennsylvania to get certified. They use the ID number on your Pennsylvania state ID or driver's license to borrow your photo from PennDOT. So you don't have to sit for a card. So if you don't, it has to be valid. It can't be expired. So that's what you need to do to get your patient ID number assigned. Once the ID number is assigned, then you can actually have the appointment. Now, appointments can be done virtually, just over a voice call. They didn't make it to have to do it over any type of Zoom or anything like that. With a lot of people just don't have smartphones or access to do that. So ever since the pandemic, they let us just do it over a voice call, or you can come to the office and do it face to face. Most people nowadays just choose to do it over a voice call. So at the appointment, you're evaluated. We're not making the diagnosis. We're just confirming you have the diagnosis, and then letting me feel comfortable to know that I can help you with the medical marijuana products. Then we go into the education about the products, and then you are actually certified. I inform the state that you're appropriate, and I'm certifying you to get a medical marijuana license. We come up with a treatment plan that day. We go over where the 4 dispensaries are in Erie, 3 on Upper Peach, 2 in front of Walmart at 90, 1 by the movie theater, the West 8th Street location, back here by Stefanelli's Candies. There's one in Meadville, Butler, Bradford, Hermitage, in the regional area. So we go over that. I look up the products. to let the patient know where they could get the specific product at the best price, especially with their discount that they may qualify for. And you walk out with a treatment plan with all your instructions, how to dose, where to go, the address, the dispensary, and whatnot. Now, by the time you get home, there will be an email that will say you have been officially certified. You need to log back into your profile, and this is how you pay the state their $50. Or you qualify for one of those waivers and you click the waiver button, and then the $50 goes away. So once you're medically certified and once you've processed the license card, then it's a 7 to 10 day wait period before you get the actual license card in the mail. You can't go to the dispensary. I can print a certificate, but they won't let you in. You have to get the medical marijuana license card before you can go to the dispensary and start treatment. Like I said, usually comes in 7 to 10 days. I'm not trying to take credit for this, but this is sort of funny. So I would get people that were actively in treatment and they needed the product now. So I certify them. And then a lot of people come in and they think they're going to be able to go. And then I'd have to tell them you can't go. So I called my liaison with the state and I said, you really need to let cancer patients go with the certificate and their driver's license. And, it was usually a 7 to 10 day wait. And initially when the program first started, it was a little longer. I think they were just not used to the process of getting these cards out. So all of a sudden, about a month later, cancer patients would call me up and say, I got the card in 3 days. I got the card in 5 days. I'm not trying to take credit for that. It's appropriate. So I called my liaison. I said, you guys are printing the cancer patient's card. I don't know what you're talking about. Now, I'd understand why they wouldn't want to admit that, right? Because someone's going to say, well, why? I got MS or I got ALS. Why does the cancer patient get to go in front of me, right? So it's just sort of like unspoken. But I have seen cancer patients literally get their cards in 3 days. I would have to say on average, most cancer patients get it in 5. So card comes, has your picture on it, ready to go the day you get it. When you go to the dispensary, you meet with a pharmacist. The first visit, it's the law that you have to meet with the pharmacist. Any other time you do not. And yes, they're real pharmacists, just like I'm a real doctor. I didn't just sleep at Holiday Inn last night. If anyone remembers that commercial.
Can you go to the different dispensaries? Or
Even in
you have to stay there?
even in the same day, you can, the two are side by side. The one up on Peach Street's the old Quaker Steak and Lube, and the one right next door to it, that's Sunnyside. Curaleaf is the old Woody's Fireworks Jelly Bean store. You could literally walk out of Sunnyside and walk into Curaleaf. They just put them. No, they didn't. They should have kept the jelly beans, huh? Right?
They offer same prices, or you might find a better price.
So it's really interesting. So the way the state mandated was you have to sell your products. If you're a grower, you have to sell your products to other dispensaries. You can't just keep your own product. So they all do sell each other's products. But what's really funny is sometimes the house brand in the one dispensary is more expensive than the guy next door who's selling their product. It's just sort of funny. So you look around. So like there's a real popular product called Bits, and it's one of the soft gels. And the Rise dispensary's regular price is $25. And then if you're a 20% discount person, you get the bag for $20. Where Sunnyside and Curaleaf both have those for $30 regular price. So then you only get it for $24. So the prices, can vary. And then they do have different sales. So, sometimes when you're on a specific product, you watch your P's and Q's and you just keep looking around. And sometimes you'll catch a 35% off sale or whatnot.
What, for instance, my pain management is in Ashtabula,
Mhm.
where I live. Can he refer me to you?
Mhm.
No.
Is it Dr.
That's
Monaco?
At the pop,
Oh, okay. Yeah. Did Monaco move in with him or no? He's somewhere else.
he's somewhere else.
Okay. Because he left St. Vincent, Dr. Monaco, and now he's practicing in Ashtabula somewhere.
Yeah. He went with the Cleveland Clinic.
Mhm. Sure.
I've been with him for years.
Yeah. Oh, yeah. Yeah. It doesn't matter who the doctor is.
So in the interest of time, are there any other questions? Oh my God, this has been so
Don't
good.
forget With his information for his office.
I didn't even think about it. I
We'll
didn't
connect.
think-
I'll-
yeah,
I'll
I'll
find
get
you
her
some
some cards.
Yeah.
Yeah.
We'll make sure that you
My,
have
my
it.
bad on that. But I do have a website. So I'm the Erie Medical Marijuana Clinic. All you do is search Erie Medical Marijuana Clinic. There's a lot of different phishing scams that they're trying to divert you to here and there. But Erie Medical Marijuana Clinic, that's me. And there's other information on the website too.
Now, if you have a certain job,
Good question.
Like I said, Kevin.
Yeah.
Deputy Sheriff, like. if
So-
he did it, is he allowed being?
So very interesting. So any federal employee, because it's still considered federal contraband, they could discriminate against you.
Yes.
Post office, VA, Border Patrol, if they do the urine test, you could lose your job. But this is a state law elsewhere. You're not supposed to get discriminated against anywhere in the state of Pennsylvania with a medical marijuana license. So you name it, I've certified it. Doctors, nurses, school principals, executives, prison guards, sheriff's deputy, couple police officers, a sitting judge, 7 elected officials, you name it, I've certified it.
I will tell you that some employers, even though it's the law, when I worked next door at interim, we would not hire people if they tested positive for marijuana, period, end of story. Even though,
And how that works is, I'd like to say it like this. So the speed limit on the highway is 70 miles an hour. Do people still speed and choose to break the law? Yeah. And if they don't get caught, they just keep doing it. So it's a civil thing, right? You'd have to hire a lawyer and say they discriminated against me. You know, it's not like the state is going to be on your side to do it.
But we're using it.
More or less. Right. More or less.
back there,
Well, if I get, when I get the talk with you, then you'll tell me how to lose weight. I think I'm the only cancer patient who gain weight instead of losing weight, but will you help me with that?
But gaining weight when you have a catabolic phenomenon going in your body is a good thing, right? No, I mean, I know, but I want you to think about that, right? So there's 2 processes. You have anabolic properties and catabolic properties. Anabolic builds cells, catabolic breaks cells down. When you have a diagnosis that's supposed to be catabolic and you're in an anabolic state, you're winning. So I mean, I know what you're saying, but that's a good thing, believe it or not.
Now, until they make, or if they make this a class 3, would it be illegal to fly with it?
It would be illegal to leave the state with it. You could fly from Pittsburgh to Philly. Yeah, Pittsburgh to Philly. You can't leave the state. You cannot leave a state, no matter how you acquire marijuana in that state, whether you buy it recreationally, illegally, recreational legally, or with a medical marijuana. It doesn't matter if a bordering state, it's legal too. No, you can't cross the state line. That is considered drug trafficking. No matter if it's, can't do it.
interesting, you're right, you're right, yeah,
Well,
interesting.
New York and New Jersey are both recreational states. You can't buy recreational marijuana in New York and cross into New Jersey. The state border is federal.
Interesting. Any other questions? And then we'll kind of wrap it up. Go ahead, Katie, and then Pam. Oh, go ahead.
You have lung meds, but they have cleared.
Mhm.
Would you say you should stay away from smoking and vaping?
Well, I mean, I don't really encourage that because that's one of the areas, again, that we just don't know. You know what I'm saying? So, the bottom line is it all depends. I have a lot of patients that are in treatment when they have, whether it's primary lung or if it's Mets, and the only way they can tolerate the treatment is by using an inhaled product. Well, if you're not going to do your treatment, you know what the potential outcome is. So you do what you have to do. But it's not my favorite way to recommend it if there's other ways that you can get a benefit.
Got another question?
So if somebody was qualified, they were a snowbird in Florida, could they take their products with
You
them?
can't leave the state with it.
We got a lot of snowbirds. Wow.
Can't leave the state. Can't throw it over the border, drive over the border, fly.
No, he's telling you the law, but
You
Right,
did it in Florida.
right.
You'd have to get recertified in Florida?
Correct. Yep. Florida's the only state where you can get an out-of-state, non-resident medical marijuana license. Florida's the only state. Half of the 40 states do reciprocate. Arizona, California, Washington. If you go to their state, you can use your medical marijuana license in their state, but you can't leave with the product.
interesting.
The product from.
What's that? Well, you've got to show them the license and then your driver's license.
Pam, you had a question? Yeah.
THC. That's what they
It
test for.
depends. We've had people over there when they've said, I've got a card and I'm on it. Just take the drug test. Let's see. Sometimes it would show up.
Some people's
sometimes it wouldn't.
metabolism's
So,
different and all
yes.
depends how heavy of a user.
Yep.
No, so it's an all natural plant product, so it's not caustic to the GI tract, doesn't cause ulcers, bleeding. It's not significantly filtered by the liver or the kidneys, and it doesn't excite the heart. So I get a lot of heart patients, a lot of renal patients, a lot of stomach ulcer patients, liver patients that can't take other medicines.
Right. Well, everyone, Doc, thank you so very
Thanks for coming.
And I just want to say, we did this so that you'd have the information. This doesn't mean you should go out and get it. You shouldn't go, like, this is just, he does such an amazing job at telling the story and explaining the why, explaining how it works. And it's for you to make your own decision. So I don't want you to think we're pushing it one way or the other. That's not how, we just want you to have the facts so you can make good decisions. Oh. Okay,
And then
perfect.
one last picture here.
Oh,
Yeah.
yes, you'll see him around town.
That's me. Devon.
I stalk him out. I'm like, oh, there's Doc. I knew it. Thank you. Yeah. Hey,
I've gotten the picture of the back of my car, like
I've sent it to him.
floated back around and it pops up.
Absolutely.
You know, so-
Thank you so much for coming tonight. We'll get his information for you. Yeah, and we'll, yes. Thank you all so much for being here. I'm gonna stop there and talk to you twice on the phone.
Oh, okay.
Nice to see you.
Oh, okay.
You're Jim Dillon.
Oh, okay. Yeah.
And I got you talking to Jim Wolf too.
Oh, okay.
Anyway, but
Do I look